Hi, Barbara.
Hello.
I would like to ask you, how do you sleep? And when we did the treatment, this is the second treatment already, right? And how you do feel about
Very,
that?
very good. In fact, when
And
I wake
can
up,
you tell your name?
yes, Barbara Heinemann. And so when I wake up even to go to the bathroom at night, I go right back to sleep. So it's a very deep sleep, very intense dreams. So I am feeling good when I wake up.
And you said earlier, about your
Getting up and
go to the bathroom during the day too.
Yes,
And
ever
we're
since
talking about the stream.
yes, ever since the first treatment, I noticed right away that when I left here, I went straight home and I'm like, wow, I really have to go. And it just started from there, and it's a very strong stream. And I feel like I'm releasing a lot, so because it's not just, oh, I have an urge to go to the bathroom. It's I have an urge to go to the bathroom. So I go, and it's very strong, and it feels like I don't feel like my bladder is like so full that it hurts. I just feel like it's a normal urge to go to the bathroom. And then when I go, there's a lot. So it's kind of surprising.
Yeah, and you feel good after that, right?
Oh, yes, yeah. And I'm drinking, I did drink extra water the first day because of the first treatment. I knew after a treatment I should do that. But I'm not drinking excessive amounts of water, but it is an excessive amount of fluid coming out. And I had been sleeping through the night without getting up to go to the bathroom. And now I've noticed, so the first treatment I think was Tuesday or Wednesday, and every night I get up at least once, and it's again a very full bladder.
And then after that, go right back to sleep.
And then I go right back to sleep.
Toss and turn.
No tossing and turning, and I go right back to sleep, and then wake up at my normal time.
And when you wake up, you feel?
I feel really good. I feel refreshed.
Oh.
Like I've had a good night's sleep. I feel very rested, and I can remember my dreams, so I like that.
Tell me about yourself a little bit.
Well, I'm 70 years old. I just found this multireflexology because I have numerous autoimmune disorders, and so I thought I'm doing all kinds of things to keep myself as healthy as possible, and I thought this could add to it. Do you want me to name some of the ones I have?
And,
so my first diagnosis was lupus, and then of course went to Sjogren's, which is a dehydration of the organs, eyes, mouth, things like that. Can cause some serious issues too. And then I have an autoimmune disorder called lichen planus, which affects the inside of my mouth. I can get lots of sores in my mouth, so it causes dehydration again, and also to the fingernails and toenails. I randomly lose toenails. It's very strange. It doesn't hurt. They just eventually drop off. But it is very difficult to deal with sometimes. Then I have a muscular degenerative autoimmune disorder called inclusion body myositis, which is kind of rare, but it's very rare having all this combination of disorders. So I do see a rheumatologist for that, but there are no medications that really help, or there's nothing they can do for most of it. So I have been on a journey of taking my own self-care in hand. For example, I swish my mouth with coconut oil. I am very strict about my diet. So I always was looking for alternative therapies because I was the executive director of the Gladys Taylor McGarry Medical Foundation, who Gladys Taylor McGarry is known as the mother of holistic medicine here in this country. And so we were always looking at different modalities and their efficacy. So I did that for many years, and because of that knowledge of alternative therapies, I knew that if with autoimmune disorders, there's very little they can do. And I did do Western medicine at the beginning because I was very, very sick. They actually thought I had leukemia at the time and found out later that it was lupus. So I did do Western medicine, and it was making me sicker and sicker. So I was directed to try a bunch of different therapies, and I had a lot of knowledge with acupuncture, massages, diet, exercise, and all of that. And so I went back to my own self-care. And of course, I was lucky enough to have doctors who are friends, the people that I worked with, and helped develop their businesses, that I was able to access a lot of alternative and more of a holistic approach. I'm very much into meditation. In fact, I teach people meditation techniques now. And excuse me. And I have been able to use all that medical knowledge. I also owned a spa at one time in Arizona.
Medical spa.
Yes, a medical, I actually was in business with a plastic surgeon, and we had a natural beauty medical spa. So we encouraged the overall approach, not just surgery. Of course, we did those too, but we believed in the healthy beauty from the inside. In fact, I called it Ama May because it was beauty from the inside. And that's why when I found multireflexology here, I thought, wow, this is something I've never tried. And I have used reflexology. I very much believe in, because I used to have reflexologists in our business. And the last thing that I really had really great success with, and I feel like I'm more stabilized now, is doing further testing with DNA and all of that. So I have done a lot of things to keep my body as centered and as focused on wellness as I can, and not just following the doctor's orders that I will be in a wheelchair or I'm never gonna feel good again. And I just don't want to buy into that thought process.
Then
is that enough?
So when did you found this? How?
I found this a few months ago. I saw a sign in the window, and I never heard of it before. So when I've never heard of it, I start researching it. And most of the things I have found on the internet have been about the beauty aspect of it. But again, I believe in the beauty from the inside. And whenever we had the medical spa, that's what we encouraged every one of our patients, is to take a look at the beauty from the inside. So make sure your diet is good. Make sure you're taking the proper supplementation. Make sure you have that peace and serenity from meditation or whatever, and not live such a high stress life. And I always considered myself a type A person because I was an overachiever, but I did get myself into a cycle of extreme stress and having issues with family and some things that were out of my control. That is what blew my immune system all to heck in a handbasket. And once I got on that spiral of getting more and more diagnosis, I knew I had to take things into my own hands. And again, because I worked with doctors for so many years, I was able to access a lot of the latest scientific advice and do a lot of the testing and things like that. and know that I'm on the right track with self-care, because it's the self-care, it's reaching out to things that I've never had before. So when I found this, I thought, I have to try it, gotta go. So as soon as I got back from Arizona, I made an appointment, and no one in Arizona had heard of it either. So I'll be happy to introduce them to
Only
my
one
results.
place in United States
Yeah.
doing this.
Yeah.
Yeah. Thank
So,
you for
yeah.
trying.
Yeah.
I'm
excited because I'm already seeing things happening.
Yeah.
So something is going
So
on.
compared to other method of treatment, how you compare
I think
this?
This so far has been, I have seen physical results immediately, like with my urine.
Yeah. Detox.
Yes, the detox is
and
starting.
Sleep.
And sleep was very different. And the next, after the first treatment, I mean, I admit I felt like I needed to detox. And when I woke up the next morning, my eyes were puffy, my face was a little puffy and stuff. But the water, I just kept drinking water and it going, cycling through. And by the time I got here for my next appointment, I started feeling better already. So after the second appointment, I have felt a lot better. And I feel like the water's going in and the water's coming out, and the detox is happening, and without discomfort. I'm not having any soreness or anything like that. But I definitely see the urination and the sleeping immediate results with. So I'm excited to keep seeing more and more things to see what happens.
Yeah. Thank you.
You're welcome.
Okay, we start for the treatment today.
Treatment
Exciting for
3.
that, right?
Yes, treatment number 3. That you can...
Excuse me. This is we call coloring. Like you coloring the picture.
That's what it feels like. That's what it feels like. You're trying to color my face.
When we do this, you feel warm up, right? Because the blood flowing. They are funny.
Yeah. Sounds like a bunch of guys.
Yeah. How you feel?
Alive. My face is hot.
Hot, right? Now we do 5 element. This is liver. Yeah, heart. Heart. Spleen. Remember right here? What is it?
Kidney.
Lung.
Lung. I knew it was someplace
On
in
the
my body.
on the side.
Yeah.
We have 2 sides of lung.
Yeah, 2 lungs.
2
That's a good
lungs.
thing.
And this one?
I don't remember. Is that the kidney?
Yeah. Yes.
Okay.
Remember on
I'm just
top,
picturing the boys.
This is the back
That's
on here,
right. That's
and right
right.
here kidney,
Yeah, the kidney at the
and
end.
on top here lung.
Lungs. Yeah.
You got it.
I'm getting there.
Okay, right now we apply heat a little bit. Feel warm. Hopefully, when we finish the treatment in the future, and that spot on your liver, they disappear.
Yeah, that spot. Yeah, that'd be nice.
So talking about your feet and hand.
Yeah, so usually I have severe Raynaud's, and so even going into the grocery store is painful for me. But at night, when I get ready to go to bed, my toes, my feet start burning, but they're freezing at the same time. And
Like frozen burn, something like that?
Yes, like a frozen burn. So I have to put wool socks on. Even in the summertime, I put on wool socks every night. And because as soon as I lay down, it starts burning, but they're frozen. And the last 2 nights, I have not had the freezing burn. And I thought, my feet are hot. And I had to take my socks off because I have wool socks that I use. They're so hot. And I thought, well, maybe it's because it's getting warmer at night. But even in the summertime, I have my wool socks on. And when I'm in Arizona, even in the wintertime when it's warm, it's very warm there to me. I wear my wool socks at night. But now,
it could cool from inside, not from outside.
Yeah, so the last 2
And now your body back to normal.
It's starting.
It's starting
I totally
to
forgot about that until just
and
I was talking
how about your hand too?
In my hands, when I was in the grocery store before I came here, only this finger got a little white from the Raynaud's, but the rest of them didn't.
That means it's only 2 treatment is improving a lot.
Yes. I was very excited last night when I realized I don't want these wool socks on. So that was very good.
That's great. Thank you.
Yes,
tell me where is tender.
Right
here?
there, right
there.
Here? Yes, like really tender.
Really tender. This one not touching your skin. You don't feel hurt or anything,
No.
right?
Mm-mm.
Okay, back to check. Is it tender?
No.
No? It's
That's-
gone, right? Let me check
That's
over here.
wild. Okay, that's tender.
Tender?
Yes, very.
Very tender?
Uh-huh.
This. Okay, check again. Is it tender?
Oh my gosh, that is so much better. Oh, I can't believe it.
How about here?
Tender.
We use this method for elderly and kid, baby, you know,
Mm-hmm.
so they don't get too much pain. No pain, no gain.
Yeah.
Okay, check again. Is it tender?
No, it's perfect.
Good. So we go over here.
That one's more tender.
Okay, check. So it's still
That's
tender?
perfect.
Perfect.
Jeez.
How about here?
That's tender, yes.
Okay, check again.
That's not tender anymore.
Good.
Wow.
Is it tender here?
Mm-hmm.
Okay, check again.
Oh, that's good. That feels... That's fine.
Is it tender?
No,
This-
that's not tender.
Not tender?
Wait, you found it. Okay, you found it.
Is it?
Yeah,
Okay.
yeah. You...
Different pressure point. That's one lever pressure point.
Mhm.
Okay, check here again. Is it
That's...
tender?
No, that's
No?
fine.
Good.
Oh,
About here.
wow.
Painful?
Yes.
Okay, check again. Is it painful?
It's still
Still a little bit?
a little
Yeah,
bit.
more. Okay, how about now?
Oh, much better. Wow. Wow.
This. Is it?
Yeah, that is
Tender?
definitely tender.
Check again.
No,
Good.
it's fine now.
Good.
Yeah.
That formula is make you relieve.
Okay.
Relieve the stress, relieve the tension in your body, and so your mind and your body connects,
Uh-huh.
and kind of peaceful
Uh-huh.
formula.
Okay.
Yeah.
That's...
And now this one, see, from this one only one, and this one 6.
Yeah.
This will give you a little bit warm up.
Mm-hmm.
How you feel? Good?
Yeah, I feel warm and fuzzy. I feel like I should be laying down and go to
Go
sleep.
to
And you know, my hands, when I come in here, I always think, oh, I'm going to have cold hands. And
now warm, right?
they're warm, yes.
The hand is right here.
Oh, okay.
Yeah, take a look at that picture in the back. See the hand?
Oh, yes. So it's like that. Interesting. So she was combing my hair, and then I combed hers. And she's like, oh, that feels so good. It was so cute.
That's cute.
6 years old. I love that age. And you know, when you have grandchildren, it's like you can remember your own children being the same way. It's really fun.
Yeah. I remember my kid when they was that age. So cute. Do you feel pain anywhere?
No.
Remember I said if you feel pain anywhere, just do about 10 times on that spot.
Okay.
Then relieve all the pain. Do this in 3 times a day. Morning.
Yeah, I do it in the morning when I was having my tea this morning.
Yeah.
And the middle of the day is the one that I
Me
think
too.
I'm going to have a hard time with. But at night, I'm doing it too. Oh, it just feels so good.
When you do 200 times.
Okay.
About 200 times, about 5
Yeah.
minutes.
Uh-huh. You know, so in acupuncture, this spot right here is such an important joining. And
Right
see,
here,
it's right
joining.
there. Yeah, it's like right at the tailbone.
Right. It's joining. So very important right here.
Yeah, the dew point, they call it. And that is one that they always stick you with that there to relax you.
So when you use the comb like this, you cover every single pressure point on your head. And you take care of the whole body. See whole body on the face. This oil smells so good.
Yeah, it does.
Right?
It does.
How you feel?
Oh, so good.
Next time I will check your spine.
Okay.
Yeah, look like it's not straight.
Yeah, I've been doing a bunch of stretches and yogas trying to straighten it out, but I don't know when that happened. actually really feels good.
Remember right here?
Yeah.
You have your eyes right here.
Mm-hmm.
You have your feet right here too.
Mm-hmm.
The whole leg right here.
Mm-hmm.
So when we do this, not only for your C1 to C7,
Mm-hmm.
but the eyes, leg, everything on here.
And that's where, you know, my muscle degeneration has been in the legs, more in this arm, these arms, both of them down, from the elbow down.
Yeah.
Has been where most of the degeneration has been, so.
With Western medicine, wherever you get problem, they go direct to that place.
Yeah.
But with this method, you go from the root.
Yes.
Like let's say you have water on the floor, right? But then if you mop your floor and you still get water coming out from the faucet.
Yeah.
And
yeah, you haven't taken care of the leak.
Yeah, you haven't taken care of that yet. You keep mopping your floor and the floor keep getting wet. But before you do that, you need to close, turn off the faucet, right?
Right. Yeah, you have to fix the problem.
Fix the problem
That's
first.
What my frustration has been with Western medicine. And, you know, when I first got sick, it's like, okay, I'm doing all this stuff to stay healthy, and it obviously didn't work. So stop everything, do this, see if this helps. And it did not. But then I went back after about 2 years. I went back to, because things